Hello and welcome to Splaining Health. In this video, we will discuss what insulin resistance is, its symptoms, diagnosis, treatment, how to reverse it and theorically how long would take to reverse it. Watch the full video to understand. To better understand insulin resistance, it can be helpful to think of it like a key and a lock. Insulin is the key that unlocks the cell, allowing glucose to enter and be used for energy. When the lock is working properly, the key can easily turn the lock and open the door. However, when the lock is damaged, the key may not fit properly and may struggle to turn the lock, making it more difficult for glucose to enter the cell. At a cellular level, there are several mechanisms that can contribute to insulin resistance. One of the main factors is the accumulation of fat in and around the cells. This excess fat, particularly in the liver and muscle tissue, can interfere with the normal signaling pathways that are activated by insulin, making the cells less responsive to its effects. Another mechanism involves inflammation, which can impair the ability of cells to respond to insulin. Chronic inflammation, which is often seen in people who are overweight or obese, can activate pathways that interfere with insulin signaling and lead to insulin resistance. In addition, genetics can also play a role in the development of insulin resistance. Some people may be more predisposed to insulin resistance due to variations in genes that regulate insulin signaling pathways. According to a study published in the Journal of the American Medical Association, insulin resistance affects an estimated 35% of adults in the United States. Insulin resistance symptoms. It's important to note that not everyone with insulin resistance will experience these symptoms. In fact, some people with insulin resistance may not experience any symptoms at all. It has been said here are some of the most common symptoms of insulin resistance. 1. Fatigue. One of the most common symptoms of insulin resistance is fatigue. This can be caused by several factors, including high blood sugar levels, which can make it difficult for the body to produce energy. 2. Increased hunger. People with insulin resistance may also experience increased hunger, particularly after meals. This is because the body is not able to effectively use the glucose from food, leading to feelings of hunger and a desire to eat more. 3. Weight gain. Insulin resistance can also lead to weight gain, particularly around the abdomen. This is because insulin resistance can cause the body to store excess glucose as fat, which can lead to an increase in body weight. 4. Frequent urination. High blood sugar levels can cause the kidneys to work harder to filter out excess glucose, leading to more frequent urination. 5. Blurred vision. Over time, high blood sugar levels can damage the blood vessels in the eyes, leading to blurry vision. 6. Slow healing of wounds. Insulin resistance can also impair the body's ability to heal wounds. This is because high blood sugar levels can damage blood vessels, which can reduce blood flow and oxygen to the affected area. 7. Tingling or numbness in the hands or feet. Insulin resistance can cause nerve damage, particularly in the hands and feet. This can lead to sensations of tingling or numbness. Insulin resistance diagnosis. It's important to note that there is no single test or criteria that can definitively diagnose insulin resistance. Instead, healthcare providers typically use a combination of tests and factors to assess an individual's risk for insulin resistance and determine the most appropriate course of treatment. It has been said here are some of the most common methods used to diagnose insulin resistance. 1. Fasting blood glucose test. This test measures your blood glucose levels after an overnight fast. A fasting blood glucose level of 100 to 125 mg/dl may indicate insulin resistance. 2. Oral glucose tolerance test, OGTT. This test measures your blood glucose levels before and after you drink a sugary solution. An OGTT result of 140 to 199 mg/dl may indicate insulin resistance. 3. Hemoglobin A1C test. This test measures your average blood glucose levels over the past 2 to 3 months. An A1C level of 5.7 to 6.4% may indicate insulin resistance. 4. Insulin resistance score. Some healthcare providers may calculate an insulin resistance score based on several factors, including fasting blood glucose levels, fasting insulin levels, and waist circumference. The American Heart Association recommends the following guidelines for waist circumference measurements. For men, a waist circumference of 40 inches, 102 centimeters, or greater indicates an increased risk for insulin resistance. For women, a waist circumference of 35 inches, 89 centimeters, or greater indicates an increased risk for insulin resistance. 5. Homeostasis model assessment of insulin resistance. HOMA-IR. This test measures fasting blood glucose and fasting insulin levels to calculate an insulin resistance score. In addition to these tests, healthcare providers may also consider other factors when diagnosing insulin resistance, including family history, body mass index, BMI, and other health conditions. Insulin resistance treatment. The treatment of insulin resistance typically involves lifestyle changes and, in some cases, medication. Here are some of the most common treatment options for insulin resistance. 1. Weight loss. Losing weight, particularly around the waistline, can improve insulin sensitivity and lower blood glucose levels. This can be achieved through a combination of diet and exercise. 2. Exercise. Regular exercise can improve insulin sensitivity and lower blood glucose levels. It is recommended to get at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. 3. Diet. A healthy diet that is low in processed and sugary foods and high in fiber, protein, and healthy fats can help improve insulin sensitivity and lower blood glucose levels. Eating smaller, more frequent meals can also help prevent spikes in blood glucose levels. 4. Medication. In some cases, medication may be prescribed to help improve insulin sensitivity and lower blood glucose levels. This may include medications such as metformin or thiazolidinediones. 5. Insulin therapy. In more severe cases of insulin resistance, insulin therapy may be required to help regulate blood glucose levels. It's important to note that the treatment of insulin resistance should be tailored to each individual's needs and may require a combination of different approaches. Working with a healthcare provider or a registered dietitian can help develop a personalized plan for managing insulin resistance. How to reverse insulin resistance naturally. It's important to note that reversing insulin resistance naturally may take time and require a long-term commitment to healthy habits. It's also important to work with a healthcare provider or a registered dietitian to develop a personalized plan for managing insulin resistance. Reversing insulin resistance naturally without medication involves making lifestyle changes and adopting healthy habits to improve insulin sensitivity and reduce the risk of developing type 2 diabetes. Here are some natural strategies that can help reverse insulin resistance. 1. Eat a healthy diet. A healthy diet that is low in processed and sugary foods and high in fiber, protein, and healthy fats can help improve insulin sensitivity. Focus on eating whole foods, including vegetables, fruits, whole grains, lean proteins, and healthy fats. Avoid sugary drinks and snacks, as well as foods high in saturated and trans fats. 2. Exercise regularly. Regular exercise can help improve insulin sensitivity by increasing the uptake of glucose by muscles. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. You can also incorporate more physical activity into your daily routine, such as walking or cycling to work, taking the stairs instead of the elevator, or doing household chores. 3. Lose weight. Losing weight, particularly around the waistline, can help improve insulin sensitivity. Even a modest weight loss of 5 to 10% can make a significant difference. This can be achieved through a combination of diet and exercise. 4. Reduce stress. Chronic stress can increase insulin resistance, so it's important to find ways to manage stress levels, such as deep breathing exercises. 5. Get enough sleep. Getting enough sleep is important for maintaining a healthy weight and reducing insulin resistance. Aim for 7 to 8 hours of sleep per night. 6. Drink plenty of water. Staying hydrated can help regulate blood glucose levels and improve insulin sensitivity. Aim to drink at least 8 glasses of water per day. 7. Consider natural supplements. Some natural supplements, such as cinnamon, chromium, and magnesium, may help improve insulin sensitivity. However, it's important to talk to a healthcare provider before taking any supplements. Now, I know you are curious and may be wondering how long would take to reverse insulin resistance. Let us consider a hypothetical 35-year-old woman, 5'5" tall and obese. The length of time it takes to reverse insulin resistance in a 35-year-old woman with insulin resistance who is 5 feet 5 inches tall and obese can vary depending on a number of factors. Assuming the woman is committed to making the necessary lifestyle changes, it is reasonable to expect that she may start to see improvements in her insulin resistance within a few weeks to a few months. For example, if she is able to lose 5 to 10% of her body weight and start exercising regularly, her insulin resistance may start to improve. However, it's important to note that reversing insulin resistance is a gradual process and may take several months or even years to fully reverse. The woman may need to continue making lifestyle changes and monitoring her blood sugar levels to maintain her progress and prevent the return of insulin resistance. Thank you for watching Splaining Health. Insulin resistance is a serious condition, but it can be managed and even reversed naturally. Comment below with any questions and subscribe to our channel for more health tips. Don't forget to leave a thumbs up if you found this video helpful. Take care of your health and we'll see you in the next video on Splaining Health.